just taking me back to my days in the late 90s. I used to be able to DJ a little bit of everything. One of my absolute favorites, Lifehouse, Hanging by a Moment. Before that, Post Malone teaming up with Mark Morrison. And it's called Cooped Up Return of the Mac. This week on Medical Mondays, we're talking about something that impacts every single one of us, from public health and safety training, from preventing outbreaks to knowing exactly what to do in an emergency. The right training can save lives. Joining us in studio is Nathaniel Block from AIM. That's the African Institute of Emergency Medicine, a division of First Care Solutions. Nathaniel and his team provide life-saving skills, training across communities, workplaces, and schools, including their incredible Mini-Medic program that's teaching even the youngest members of society how to respond in an emergency. Nate, welcome to 919.
Thank you so much. It's a pleasure to be here.
How you doing, man?
No, very good. My parents always said I had a face for radio.
Yeah, me too.
So I'm very excited to be here.
All right. Let's jump right in, shall we? How was your holiday, by the way?
Oh, no, it was like UK and Canada was lots of fun.
No, you were saying that you weren't given any grace.
No,
you had to pay for everything yourself.
The most cost-effective places.
How rude, man. You need to tell people you must help us out.
I know.
You wanted to enjoy your holiday, not spend all your money on it, right?
But South Africa is definitely a better place to live. So that's why we're here.
So we have the best weather in the world, right?
100%.
There is nobody in the world that has better weather than us.
No.
I mean, we could have 4 seasons in one day.
Yeah.
But still great, right?
But all 4 of them are enjoyable. Yeah.
I don't know so much. What? Let's jump in. Nate, for those unfamiliar, what exactly falls under public health and safety training?
So essentially what falls under public health and safety is anything related to the OSH Act of 1998. So the Occupational Health and Safety Act that governs South Africa and is gazetted in our law. That's all of the training is what falls under there. So it's everything from first aid to fire to hazard identification, risk assessments, environmental laws, mining, construction.
She's got a lot.
Basically, anything that you can think of in the workplace falls under the OSH Act.
Wow.
And we provide training for all of those different sectors.
Gee whiz. Why is this kind of type of training vital for both general public and professionals?
I think the biggest thing is that it saves lives.
Yeah.
So it's not just about prevention, it's also about treatment. So teaching people first aid, how to treat, the injured, both medically and trauma related, but then also preventing emergencies. Like you spoke about earlier, preventing spread of disease and things like that.
Yes.
Also preventing various disasters in the workplace, also very important.
If you now, for example, I've always wondered this. You come across, let's call it an accident scene of some sort. At what point, how do you triage, for the lack of a better word, what's important and where to start?
So I think triage is the right word there to say, well, okay, where do we start? What's the highest priority? But then I think the best place to start would be training. So if you're in your car, immediately you need to look out and you need to say, okay, what are the hazards? Is it safe for me to stop? Do I have the equipment to stop? Because you can get out and then after...
I never would have thought of the can't stop or not.
Yeah.
I never would have thought of it.
Can I stop? Is it safe for me to stop here or not? What other hazards are involved? Do I have the equipment? Then once I get to scene, what am I actually going to do? How do I assess a person? How do I tell how sick they are? How do I tell how injured they are? And then do I even know the number to call? Do you know the number to call?
I don't actually. No, and I think I'm going to get a hiding when I get home.
Yeah, you might. So then your soon-to-be wife is not going to be very happy with that answer. Although you'll probably just phone her.
Yeah, I will probably.
Yes. And that's sort of one of the places to start is to say, okay, well, who do we phone? If you do see an accident that happens in front of you, who do you phone? A lot of people say 10-111, but that's police. That's not an ambulance.
Correct. I know that.
And then, that one.
That I know.
And most people don't know that certain, numbers have been discontinued and you need to follow different channels.
Yes.
And most of us don't know that.
I've had somebody say, is it 082-919? I'm like, no, guys. All that is a really nice endorsement, I must just tell you.
Good endorsement.
What are the biggest misconceptions people have about health and safety and the measures?
So I think there's 2 main things that people have a misconception about. The first thing is that things are already in place. So you get a new job, you're young, you're excited, you go into this massive firm, let's say 500 employees, and you think, okay, well, their occupational health and safety must be, absolutely amazing. Everything's set, everything's ready. And you start first emergency happens and you need to stop somebody from bleeding. Somebody's got a cut on their arm and you need to stop the bleed. And then you very soon realize, okay, but there's no first aid kit. There's no first aider. There's no one trained in it. Or you have your first evacuation and there's a small fire.
Yes.
No one knows how to use the extinguishers. So it's the first thing is that we think that these things are in place and they're actually not.
Okay.
And then the second thing is to understand that these things don't stop disasters from happening. They just prevent how...
So for it to get from getting worse, yes.
But things still happen. You can't... If somebody's going to have a seizure, they're going to have a seizure.
Yes, of course.
You can't stop it, but you can have things in place to make sure that the repercussions of that are...
It doesn't get worse.
Exactly.
Just out of interest, if we don't have a first aid kit, how do we stop the bleeding?
It's a very good question. So the South African law speaks a lot about improvisation. So whether it's using clothes of the patient or cloths from the kitchen or just getting something to be able to stop the bleed. But you can absolutely improvise. It's not the best. It's not gold standard medicine, but that's something you might just have to do.
And in terms of, so here's something that I was doing a little bit of reading on. I'm super excited. And a couple of the people that I have in fact spoken to about this, also very, very excited, is your mini medic program. Such a unique idea. Can you explain to us what it's all about and what it's designed, who it's designed for?
Sure. So mini medics came into fruition about 10 years ago, and it was really designed for children. We looked at statistics from various different countries, Sweden, Switzerland, a couple of European countries have said they have really low cardiac arrest death rates. Okay. So out of hospital, somebody has no pulse, they're not breathing, who starts CPR? And we looked at those countries and we saw that their stats are amazing. A lot of people are surviving cardiac arrest out of hospital. And the biggest reason for that is that CPR gets started immediately.
Okay.
Within 4 minutes of somebody going to cardiac arrest, it is started. The big question is by who?
Yeah.
And if you look at those countries, most of it is started by children. So children under the ages of 10 in those countries are starting CPR or at least guiding an adult nearby to come and start CPR. And so we said, well, how do we bring this to South Africa? How do we actually start something like this? And so what we did is we designed a mini medic program.
Okay.
And what that does is it teaches the ages from about 5, 6 years old all the way up to 12. Okay. And the reason for the cap at 12 is then you can do a full first aid course.
Okay.
So, and the cap at 5 is obviously we need to still be able to learn and have different teaching techniques. So it's a custom course. It's a very practical course. It's a 2-hour-long course. And we basically...
Quick as that.
It's quick as that.
Gee whiz.
And it's completely hands-on. So there's no... You can't lecture to a 5-year-old. No. So we have the classes and we have very well experienced and well trained instructors. We use different techniques brought in by occupational therapists and we teach them how to do CPR.
Yes.
We teach them how to manage bleeding. We teach them all the numbers that they need to phone in an emergency.
Not 911.
Not 911. Listen to 911, but phone 911. But there's all the different numbers that they can phone. How to treat burns. We teach some water safety and how to make homemade rehydration solutions and things like that. So it's really about getting the kids involved. Even if they don't have the strength to do CPR themselves, they can still teach an adult nearby in under 10 seconds how to put a hand on the chest. That's
quite revolutionary. That
it's amazing.
I saw something a long time ago, and I don't know. Sometimes I never know how accurate these programs are. So I used to watch this program called The Good Doctor.
Yes.
And
Doctor.
Yeah, right, yes. Right. And they talk about in the very first episode that there's this child lying on the floor. The child can't breathe, so the guy who's the tending before the actual doctor gets to him says, you're putting pressure in the wrong place.
Yes.
Said, no, I think I remember enough of anatomy to know like how to stop the bleeding or how to and he goes, no, but that's for an adult.
Yes.
This is for a child.
Yes.
What you're doing is you're blocking his trachea.
Yes.
Like how prevalent is that kind of stuff with what you're doing with the kids in terms of like anatomy and how they get it all right?
Yes. So it's a very good question. And I think with all the new series that are out, people love medical shows. And then you work your first shift in an ED or on a response car, and it's completely different. Completely different. There's, as much as I love the Good Doctor, it's very inaccurate in many medical senses, but it's a fantastic show. To answer your question, though, anatomy and physiology is different in children versus adults, but we really focus on what is going to save a life. So being able to press a centimeter difference on someone's neck is probably not going to be the end of the world. They needed to dramatize things a little bit for the TV, but we really teach the big things. So yes, CPR is different for children than adults, and so we absolutely then cover that.
And you know what? And clearly that must shorten sort of the trauma time by the time the professionals get there. So what all you're doing is you're minimizing the risk, or at least whatever the patient is going through, to go, okay, let me start this CPR. When the professionals get you, half of a portion of their job has been done. So risk has been minimized, right?
So I don't know if I'd use the word, so risk is true, but the word I'd more use is you're increasing prognosis. So there's a lot of times where, so let's say on average the human brain can survive 4 to 6 minutes. So between 4 and 6 minutes without oxygen, brain's dead. All right?
Sure.
So if CPR hasn't been started in under 6 minutes, it's not just that you've helped the paramedics in starting their job, or that you've minimized risks and things like that. You've actually saved or helped save that person's life.
Right.
If you wait longer than that time, there's often not point doing CPR at all. So often we get to scenes and we'll have to do a declaration, or we might choose to not initiate treatment based on the fact that CPR hasn't been started. It took us too long to get there.
Sure. In terms of, we're going to take a little bit of a music break in just a second. We're designing a training program. What are the must-have elements?
So there's quite a few, but just to focus on the main ones, number one has to be evidence-based. So there has to be evidence that backs exactly what we do, why we do it, when to do it. We have to have literature that supports what we teach.
Yes.
There has to be a level of standardization to make sure that the same thing is being taught across the board. And then there needs to be some type of accreditation. Whether the accreditation is through an official channel, like the government regulator channels, which should be, but even a peer-reviewed process where it goes through what we call subject matter experts who have looked at the program and have decided, you know what, this is good quality information. This we can get out to the public. So just making sure that those elements are there when we're starting a new course.
And on what sort of, in terms when you talk about accreditation, are these doctors or people that have been in the industry a long time, guys that speak from a position of authority?
It's a very good district. I don't know how political you want to go. Very often, I love the laugh. Very often they get subject matter expert to look at the curriculum.
Gotcha.
But the actual inspections and accreditations are not actually done by industry experts.
Okay, gotcha.
So you have to be accredited by various departments. So in South Africa, you have to be accredited by the Department of Employment and Labour. You have to be accredited by CETA, and you're
it's a lot,
accredited by QCT.
This is obviously why it takes so long, right?
It does, yes, and it's a very expensive process.
When we come back, we're going to chat a little bit about how you adapt training for schools, offices, and hospitals. We'll do that on the other side of these. All right. 91.9, Ronan Keating, Love and Edge Day. Chatting to Nate Block from the African Institute of Emergency Medicine. Nate, how do you adapt training for different audiences like schools, offices, hospitals?
Fantastic question. So the easiest way to answer this is to say that all of our courses are practical.
Okay.
So one big thing that's different in I think a lot of South African training companies or current companies worldwide, first aid and things like that have always been a theory-based course.
Yeah.
And we've taken a look at that, and we've, as instructors, with all of us with more than 8, 9, 10 years experience, we've said it's historically been a very boring subject to learn.
Yes.
We need to make this practical. We need to make it fun.
Okay.
And so all of our courses are practical. So if you're a school teacher and you come to us, all of your scenarios and your entire textbook, the way it is taught is tailored to being a school teacher with the ages that you teach.
Okay.
So yes, we'll cover the adult patient. But we're going to focus that time on the students that you're going to encounter the problems. If you're in a workplace, we're going to, or let's say you work on a construction site, we're going to focus on the trauma type injuries that you will get on a construction site.
Got you.
And then you'll be marked, your practical will be marked then on a situation that will be common for you.
Okay.
And so we completely customize every single course we teach. We're very big.
Gee, that's very helpful, eh? Gee whiz, that's incredibly helpful.
So we're very big at the moment in the restaurant industry. And so in the restaurant industry, we're teaching chefs, we're teaching waitresses and waiters. It doesn't make sense for them to be focused on a baby when it's a restaurant that serves alcohol.
100%.
You know, we know that babies are not really going to be there a lot.
Yeah,
Hopefully.
absolutely.
And so they need to be focusing on what's going to happen in front of them. And that's really where we spend our time, yeah.
In terms of the health risks, what, in your opinion, the health risks in South Africa, what do we need in terms of urgent training at this point?
I think this question is twofold. You highlighted one earlier. You said what happens when I drive past a car accident. So I think trauma is a big thing for the general public.
We're really good at this, you know.
Yes.
Dr. Furman was telling me the other day that she was like, we talk about like the Australians are good.
Yes.
But South Africa is on another level, man.
We are very good. Our first responders, first aiders, CPFs, they're on point.
Okay.
Even a lot of
Amazing.
our police are very well first aid trained. Our firefighters are all trained. And so they get to see, and our trauma capacity is incredible.
Wow.
It is phenomenal. But we do still see a significant amount of trauma. And so it's about how long does it take for a professional to get there? Someone needs to be helping in that time.
Absolutely.
Someone needs to be there
Fill the gap, yeah.
to fill that gap, that sort of first responder gap. So from that point of view, it's just about getting that training of, okay, I stop at a scene while a car accident happens in front of me, like we discussed earlier.
Yeah.
Who do I phone and how do I help?
Got you.
And then from a workplace point of view, remembering that every person is a entity of medical conditions.
Yes, got
Right?
you.
If you look at any of your neighbors and you say to them, okay, listen, buddy, tell me about your medical history. You'll sit there for quite a while.
Yeah, you will.
And,
You're right.
You know, this person you think is your friend, you think you know them really well. How well do you know the person sitting next to you? Because if they
Scary.
have a seizure, do you know that they're epileptic and what to do when they have a seizure?
That's scary.
You know? So I think for the workplace, focusing on medical conditions, and actually, I like to say you need a medical buddy. So you need
Agreed.
someone in the workplace that knows your medical history.
Yeah.
What are you allergic to? What medication are you on? Because do you know this about your friend at work?
Yes.
But this could be life-saving when a paramedic gets to scene and needs to actually help your friend.
Wow.
So I think we need to get a medical buddy system in place.
So that's the secret here. Get to know your friends better, right?
Yeah, absolutely.
The most common gaps in people's knowledge when it comes to emergency response. What are they?
It's the basics.
Okay.
It's who do we phone? It's as simple as that. What are the numbers, both state and private?
Yes.
But not just numbers. When you're traveling, those numbers change.
Yeah, of course.
So if you're in, the middle of Postmasbach, who's your closest ambulance service? So whenever I travel, I'm the nerd that does research before I travel.
Got you.
Which ambulances are in that area? Which heli can fly to me if I, fall off the mountain and need to be rescued?
Yeah.
You need to know who are those. So basics. The other thing I think where there's a big gap is with home remedies. Now, I'm not saying home remedies don't work, but I'm saying we need to be cautious with them.
Yeah.
So in the hospital space, and I think perihospitally as well, when we get to scenes, we're still seeing a lot of things that are being done, shoe polish on a burn and toothpaste on a burn. And we're seeing horrendous things happen. That a lot of people think help a lot. And we still see a lot of the spoon in the mouth if someone's having a seizure or throw cold water on them. And these things make it so much worse. And I think that's where a lot of the gaps also come in.
Jeez. And this is where you guys come in.
Yeah, absolutely.
Can you share, and I'm sure you've probably seen a ton of it, can you share a real-world example where training like the Medimedics or others have made a big difference in an outcome?
So I think the best place to look there would be your CPR survival rates. So I remember quite a few cases getting to scene and, working on an ambulance, getting to scene, seeing that CPR was started and was started really, really well.
Yeah.
You sort of walk into that room, I walk in the room, I've got my ALS standing next to me, my advanced paramedic standing next to me, and we look at this case and we're saying, well, are we even needed?
Yeah.
These guys are on point. They're doing the things, okay, cool, we can do the fancy things. Let's put up the drip. The ALS can do the intubation and, do the advanced things. But when that patient survives, and we've had a few of them that have survived with good neurological outcome, to look at that and to think that would never have happened if the first aiders didn't start CPR. It would absolutely. It took us 25 minutes to get to scene, which is quite a good time in South Africa. 25 minutes to get to scene. That brain is not alive if nobody started. And so that's really, and so taking first aiders through AIM, we train them up and then seeing them on a scene, that was quite an amazing.
It must be quite rewarding, I'm sure.
Very, very much.
Are the lines sort of, now this is a sort of one of the questions that I didn't put, and this was just something that I was thinking about as you were talking. Between yourselves and the paramedics, first responders, are the lines in terms of who does who? Those lines are obviously quite blurred in terms of who does what specifically. Okay, I'm not trained to do this, I can't do this. Or do you just get on with it?
So they're actually not blurred, which is, I think, the good thing, is that the Health Professions Council of South Africa is actually very clear on what people can and can't do. So something that you'll notice is whenever an ambulance arrives, immediately the medic or the paramedic will be wearing a badge with their name, surname, and qualification. What that qualification can do is public knowledge.
Yes.
And so, yes, the average person doesn't necessarily need to know that, but the crews on sea is part of our first aid course. We teach them, hey guys, this is what this qualification can and can't do.
Got you.
And then also on our first aid courses, we emphasize this is what you can and can't do. Okay. Because we do see a lot of things where first aiders will go to scene and then do a lot of things that they're not supposed to.
And it does more harm than good.
And then it does more harm than absolutely.
No. If you could, and this for me is always part of this is one of the most exciting parts of the show. If you could introduce one new nationwide public health initiative tomorrow, what would it be?
Brilliant question. I would love to meet with the Minister of Education.
Okay.
And I'd love for first aid to be brought into life orientation.
Okay.
So it's something I've thought a lot about. So when I did see this question, I was like, easy answer.
Amazing.
I remember doing life orientation you do it right from grade 8 to matric. I think many medics should be brought in from primary school.
Yeah.
But then from grade 8 to matric, there's so much that we do in life orientation, but there is still some gap for more, things to be part of it. And I remember when I was in matric, they said to us, you can choose what you wanted to do. You could either do like a community service outreach, or you could do a first aid course, or you could do, I think it should be compulsory that from grade 8.
I think so too. That sounds very interesting.
Course. And it should be part of the curriculum.
Yeah, absolutely. No, you know what? I just feel like at this point, knowledge is power, right?
Absolutely. And that's what Mandela said, knowledge is power.
And you're at that point where you're saving lives.
Yeah. Absolutely. And if you look at countries where they have implemented this, they have the lowest cardiac arrest death rates out of any other country in the entire world. Wow. Countries like Sweden, Switzerland, like we mentioned earlier, they've implemented this. By the time you are 10 years old, you are qualified in first aid. And we should really be looking at that and then from high school, we're talking 14, 15 years old. So there's no reason why we can't be doing it.
Huh. Now I'm a young adult, or I'm heading towards the end of school, or I'm just thinking about something to do. If we want to get hold of you and do mini medics, or we want to do a paramedic course, where do we find you?
So aiem.co.za, so aim.co.za. All of our details are there. You can email us. You can book courses from the website themselves. We love doing group booking. So we love when a school contacts us and says, listen, we do special rates and all of that. But besides the point, we'll contact the school and say, okay, we'll do custom dates just for you. We'll come and train the entire school. Wow. Do it in 3 days. No problem. We'll train the entire school.
You guys are a lot of fun on Instagram and TikTok.
Yes,
you guys make the greatest videos, man.
We have very good production.
No, I do enjoy it. I'm watching them and I'm like, you guys are like all over the place. So to follow actually on Instagram and on TikTok, actually it's at AIEM. Yes. AIM.
Yes.
Just ignore me. Nate, thank you so much for your time.
Thank you for yours.
If just in final last questions, what is that website again for us?
So it's aiem.co.za.
If you want to be a paramedic, or you want to send your kids, or get these guys to come to your school, or learn about anything, just come and head over to the website. Nate, thank you so much for your time.
Thank you so much.
I have learned so much today. I have learned.
You're going to come on the first aid course?
I will.
Fantastic.
If Jess allows me to, I will. Yeah. But
I'm sure we can sponsor one for Paul.
No. I'll pay. Nate, thank you so much for your time. All the best, and thank you so much for all the work that you do that nobody else ever sees. Thank you so much.
Fantastic. Thank you so much.
991